Hi, everyone. Thank you very much for the opportunity to present in front of you all today. I would like to share a very exciting initiative with you guys from the phage on how we are integrating multiple learning strategies into our wastewater surveillance bioinformatics course. So the pandemic, though not too recent, highlighted the specific need for bioinformatics in public health response and the urgent need for practical tools and training beyond the academic space. Wastewater monitoring provided an opportunity and proved to be highly effective in acting as an early warning system during the pandemic, helping us identify the presence of pathogens before the presentation of clinical cases. Expanding the capability to a global aspect, especially in under-resourced settings, proved very important, just not in the aspect of sampling of the wastewater as well as the sequencing of the wastewater, but the implementation and the development of bioinformatics skills to process, analyze, as well as report a complex variety of data sets. So phage's role in the development of this course is very crucial because we decided to shape it to be highly impactful and highly practical. We decided to draw on a variety of domain experts to help design a very hands-on, very interactive, as well as implement real-world data sets to ensure that the overall wastewater surveillance course was incredibly effective for the people who were participating in it. We also decided to take the approach of implementing a variety of learning strategies, so specifically text-based documents, lectures, audio files, dashboards, as well as game-based learning, so that learners with a variety of learning styles can actually effectively engage with the course as a whole. So, as we were busy designing this course, we decided to make it modular and balanced. We decided to start with some of the foundational concepts within wastewater surveillance, such as the impact of wastewater surveillance in public health, wastewater collection and sampling, as well as the downstream wet lab analyses and methods that are conducted on those samples. Once we were confident that the participants had managed to establish the foundational concepts necessary, we decided to then move them on towards a more hands-on approach of data processing, quality control, lineage determination, and then generating the necessary data plots and reports to the various stakeholders that were required. We specifically decided to take a hands-on approach because we believe that this helps mirror real-world scenarios and public health challenges, allowing learners to actually fully implement and integrate the pipelines and make the respective decisions based on their needs. This particularly ensures that the bioinformatics component of wastewater surveillance is not only understandable, but actionable as well. So, specifically with regards to the integrated learning approaches, we understand that various learners learn in different styles. Some learners may prefer text-based formats where they read through documents and lessons. Other learners may prefer hands-on video lectures where they actually get to hear directly from a subject matter expert or lecturer. Others prefer some sort of auditory interaction, so a common one that we have come across is podcasts, while other people are kinesthetic or very hands-on and prefer very interactive sessions. So we decided that with this particular course, we would actually integrate all four of these approaches, and one of our favorite ways in actually ensuring that the teaching was interactive was by creating a storyline/game-based approach, in which the participants actually follow an avatar in the form of a bioinformatician as they tackle real-world bioinformatics analyses and wastewater surveillance challenges. Each module that we have set up in this course makes the learning extremely immersive and meaningful, but at the same time ensures that all of them are memorable so that they can actually build the skills necessary from the foundational concepts all the way to the more intermediate and advanced ideas. Oops. Our instructional design specifically decided to use one of 3 different frameworks. So we decided to implement the pedagogy approach, which involves direct instructional or direct instruction for core concepts, such as those that we applied within the command line interface module. On top of that, we decided to implement andragogy, which focuses more on peer-based interaction, where you use real-life case studies or scenarios in order to understand exactly how to communicate effectively with others as well as the instructor themselves. Lastly, we decided to use heutagogy, which is more of a self-directed learning through a capstone project. So with this particular capstone project, we decided to let the participants of the course actually build or implement the pipeline itself and build a wastewater surveillance dashboard, choosing their own data sets, tools, and their own visualizations that they would actually like to report on. The reason why we decided to implement this capstone project was because, as I mentioned earlier, it mirrors the real-world complexity of wastewater surveillance. There is no single right way to report this information. There are only the things that we can teach them what to show or what to make decisions on, and then implement those for their own respective needs. So this particular course is one step in a broader effort to actually build capacity, collaboration, and a data-driven workforce. The next public health crisis is not a case of if, but when specifically. And bioinformatics is no longer a niche field in the public health space. It is a necessary key skill that needs to be made understandable but usable for everyone, and making it even more extremely essential. So over here you can see the participants that we have had for the pre-workshop conference that we had, where we chose and isolated some of the key modules from our particular course and decided to implement it in a pilot situation, and the feedback from this particular course was extremely positive. I would just like to acknowledge all the subject matter experts and organizations that were involved in developing this course, and for the Bill and Melinda Gates Foundation for helping establish it. Thank you very much.